Hello and welcome to our third video. In this short video, I will be demonstrating how to process a situation order. A situation is when a patient, for whatever reason, was not able to either keep an appointment they had to get their labs drawn or actually came into the clinic, but maybe the technician or they were running late and they, for whatever reason, could not stay and they had to actually reschedule or just come back another day. I do want to mention that a lab stays valid in ECW for 45 days. So, for whatever reason, if the patient cannot keep that appointment that's been scheduled, they do have the opportunity to come back within those 45 days to get those labs drawn. Now, whenever they do come back to the appointment for those labs to be drawn, sometimes they may make an appointment with the technician only, or sometimes they'll just come right into the actually lab section and ask you to draw their labs. And with that being said, when that appointment or they just pop in to get their labs drawn, they actually don't have all the information needed to give to you as far as who the provider is or what type of labs are needed to be drawn and stuff like that. So if that should ever occur to you, we have a process on how to actually find the correct labs that the patient is referring to and making sure that they get processed and the results get sent back to the provider. So let's begin. When a situation like that happens and you're really not sure which lab orders or who the provider is that the patient may be referring to, you want to go ahead and head towards the L Jelly Bean. And when you do that, you're going to get a drop down menu. You always want to select the lab option. When you do so, it's going to take you to the screen that you have in front of you, which is the lab module. Here is where we store all our lab orders and lab results for a patient. If we mosey right down along this blue band, you're going to see here quite a few categories. You have the outstanding tab, which houses all our current orders that have been sent to LabCorp. Okay. Once we have transmitted the orders to LabCorp and our LabCorp sends the results back, all the results are going to come back and they're going to jump into the to be reviewed tab. Once they come into the to be reviewed tab, the doctor's going to get a notification through their L Jelly Bean that you see right here, and they're going to get a count. It is now the provider's job to actually review those labs and mark them reviewed. Once the labs have been reviewed by the provider, they're going to be housed in the reviewed column. Okay. Any future orders, you click on future, you'll be able to actually search for. The by patient is a popular tab. Here is the tab that you want to select if you're actually investigating and you're searching for particular lab orders for a patient, a particular patient only. If you wanted to see a combination of all these, you can go ahead and select the all tab. The canceled and the copies tabs, we really don't use. Okay, so for this particular training, we're going to go ahead and select the by patient tab. And as you can see, nothing's appeared. So for this training now, I want to go ahead and I want to select my patient that's come in and is asking to get their labs drawn because they missed their appointment maybe a few weeks ago. So I want to go ahead and type in the patient's name. And once I do that, it's going to search the database and it's probably going to give you a variety of names to select from. And you can go ahead and choose the correct name. And once you do so, it may or may not populate some data. But we want to make sure that we continue to fill in all these categories correctly to make sure we get the correct data. The facility, you always want to make sure it reads all, because at this point, when you're processing a situation order, you really don't know which facility the provider was stationed at the time. Sometimes patients go from site to site. It's not always just one particular site that may be on the patient's designated site. So the assigned to, again, because we're not sure if the patient has more than one provider or, who the provider is, we want to make sure that we leave that at all so we cover all our bases. Okay. The lab, if we knew the name of the order, then we can go ahead and type it in. But for this instance, we don't. The diagnostic category here, because we don't do any diagnostic imaging here at Unity Healthcare, we're going to go ahead and leave that blank. The procedures, at this moment, we're not actually processing or looking for procedures, so we're going to leave that blank. The date is always going to automatically populate to today's date, and it'll go back several months or several years. Moving right down below, we got this blue band. And it's got quite a few categories here that we need to actually deselect. Okay, so we're looking for labs, so that should stay selected. Imaging, we don't do diagnostic imaging, so I'm going to deselect that. I am not looking for procedures right now, so I'm going to deselect that. Am I looking for an in-house lab? Absolutely not. I'm looking for lab orders that have been placed to send to LabCorp. So I'm going to deselect that. Send out, that should stay selected because it's going to be sent to LabCorp. High priority, I'm going to deselect that. Outstanding, has this order been placed? No, so I'm going to leave it as an outstanding. The received, I don't want to see lab orders that have been received by the provider, so I'm going to deselect that. And I also want to deselect the reviewed. So when I do that, it's going to actually pull up more information. And here is where I'm going to be looking, because we're processing a situation order. I'm going to be searching for a lab that has been ordered within the 45 days. Okay. I'm going to be searching and making sure which lab orders do not, I repeat, do not have a collection date, which is an indication that they may be one of the lab orders that we need to process for this particular patient. Here are the name of the labs and the interface status. Okay, it does not read transmitted to LabCorp. So as you can see here, we have quite a few labs that the patients had that has not been processed. We have the acid fast that was placed on 5/14. We have a chlamydia that was ordered on 4/28. We have a lead, hemoglobin, amylase, and a CBC, ammonia, and a progesterone. Now for this training, we're not going to go ahead and process each one of them, but this is a clear indication that all these lab orders can be submitted to lab orders, can be processed, because they do fall in within that 45-day limit. Anything else, anything with the date like March or something, would not be able to be transmitted. Okay? So for this particular training, I'm going to go ahead and process, let's say, this hemoglobin. So at this point, I want to make sure I become the second eye for the provider. I want to make sure that all these lab orders that I'm about to process have the UHC prefix, that there are no duplicates, and then I will be checking to see if an assessment code has been attached to these orders. So I am going to go ahead and double click on the order. And again, it's going to take me to this lab result window. Now, again, this is something, this screen, this pop-up is something familiar. You've seen it in both videos when processing the same day and the current. We'll always want to confirm, the same day and the future. We're going to always confirm that the patient's name appears here and it's correct patient. Now we're going to basically start our processing. We're going to fill in the 6 mandatory rules. We're going to go ahead and the assigned to. We're going to go ahead and select the collection date, the time, the source. We're filling in all the categories we have been doing for both the current and the future. We're going to go ahead and fill in the clinical information, which is all tube information. I misspelled something. Okay. And then we're going to go ahead and timestamp it. But as you can see here, we have some assessments. We have actually, the provider has actually assigned, has linked 2 assessments for this order, but he did not check them. So with that being said, because they are not checked, as you can see right here, I'm going to go ahead and put in my internal notes, diagnosis code missing. At no time as an MA or a lab tech or someone who's processing the orders, are you to select these assessments. At no time are you supposed to place a check, okay? That is only for providers only. So once you've completed the 6 mandatory fields, you've confirmed whether or not there's some assessments or whether the patient is a heart stick, you want to go ahead and click OK. Okay, now what you want to do, it was the hemoglobin. As you can see, it's now collected. So now I want to go ahead and check this order. I want to head towards this More Action tab here. I want to click on the drop down arrow, and it's going to give me, as you can see, options to choose from. I want to go ahead and transmit my order. It's going to give me a pop-up that reads Select Lab Company. I'm going to click on this arrow. I'm going to select the LabCorp option. I want to hit Transmit. And what it does, it's going to actually give you the same thing that I've shown you in both videos. It's actually going to give me a copy of, it's going to give me a print preview of the requisition form. I can click on this X just to enhance the information so I can get a better view. I always want to confirm the site, the provider's name, the patient's name. Okay, I want to make sure that the lab is listed there with the code, that it shows my tube information, it shows the specimen. And if it does show all that, then I can go ahead and click on print. Once I print that requisition, I can attach it to the specimen, and then we can place it in the bag ready for pickup. And that pretty much concludes on how to process the situation. Thank you for watching.